Hello and thank you for watching this other One Health Important Zoonosis video. Today we'll be talking about leptospirosis, which is a globally important zoonosis. So, for a little introduction, leptospirosis is a zoonotic bacterial disease that occurs in diverse areas, but especially in research poor populations. And due to the heat and moisture in the tropics, that is very conducive to this disease. But it does not only occur in the tropics, as we will see in just a bit. It can occur everywhere, even in temperate areas during the summer. This disease is caused by a spirochete bacterium that causes a range of symptoms to humans, from mild fevers and aches to renal failures, hemorrhages, and meningitis. So it can be misdiagnosed for other things that looks like a flu or malaria or dengue, um, but it can, however, get fatal and lead to multiple organ failure and can lead to deaths. But of course, there is no specific symptom that is characteristic for this disease. Rodents are usually the reservoirs, and though asymptomatic, they will shed the bacteria into the water and soil, and that would cause a direct route of transmission to other mammals or to humans. However, it's very important that the epidemiology of this disease it varies a lot according to location or according to which part of the world you are, according to environmental conditions. So rats, of course, are not the only reservoirs. There are many other animals, such as mice, dogs, cows, that are responsible for spreading this bacteria as well. And they shed it asymptomatically through their urine for it could be years or all their life. Right. So whenever an animal sheds it and is not affected, that makes it uh, a reservoir. Um, just a little map here in terms of um, this study done by Costa et al. That shows that there are over 1 million cases worldwide, and that can lead up to 60,000 deaths per year due to this disease. And again, I just want to point out here, if you notice, if I point out the belt of the tropics, this is where this disease occurs mainly, right? So, of course, the heat and the moisture is something that would lead to more cases of leptospira. But like I mentioned earlier, up in the north and in the south, there are still some cases due to the fact, well, this exists everywhere. And if, for example, if you do summer sports in the temperate regions, this could lead to exposure as well. In terms of transmission, it's usually through an asymptomatic host who will transmit it through their urines if they are infected to soil and water, and then that could lead to infection to humans and other wild or domestic animals. So we're talking about wildlife or livestock and pets, right? And I will also introduce here, well, the most common symptoms that can happen for human infection. Again, it can be something as simple as a fever and aches, but if it is not detected and treated early enough, which is already a big difficulty, it can lead to more multiple organ deficiency, such as renal, hepatic, and pulmonary failures. Um, so it's really it can really depend and it's really hard to detect. So uh, it highlights the importance of One Health and keeping us safe from this disease, right? I look up a little bit of symptoms in animals. Again, it's very non-specific. It won't have a one symptom fits all for all the animals. However, it is well known, for example, for livestock animals, so such as cows and sheep. You will have an increased case of abortion, stillbirth, infertility, and another thing is that it damage production as well. So milk will decrease, milk production will decrease, and sometimes you might see slightly red stains in the milk. But again, it varies here. You can pause the video and take a look at different ways that animals can be affected. This is from CDC, and you can go ahead and look up any materials that they may have as well that helps you. However, talk to your veterinarian if you suspect your pets or your livestock has any uh, have any new symptoms that you might not be aware of. Always keep in touch with your vet. So, how to prevent this disease? So again, it is a disease that spreads through the environment, so through water and soil. So keeping away from water that might be contaminated with animal urine, especially, and this is how a lot of the cases, well, they spike after floods and hurricanes and or heavy rainfalls. This is where you would get a lot of cases in the tropics. For example, if you have a hurricane here in Belize and you go out barefoot and you're swimming in the flooded waters, right? This is a perfect conduit for you to get infected with this disease. And of course, not only this disease, there are many other diseases that you can get while swimming in flooded waters, right? So, yeah, avoid contact with animals that may be infected. If you suspect a dog, a cat, or pets or livestock, you know, take the precautions, protect yourself, use proper gear before coming in contact with those animals, especially the urine. But of course, other bodily fluids can anything regarding to blood or placental excrements could also host some of these bacteria as well. Take precaution before water recreation activities. If you take part in water recreation like swimming, boating, fishing, you do want to be aware. I mean, probably here in Belize we don't have warnings according to region, but you try to take your precautions as much as possible. And if your area is infected in terms of gardening and outdoor activities dealing with soil, this is another way that you can can be risky. High risk workers like veterinary professional farmers who are, high risk and have high exposure. Well, all we can do is advise you to wash your hands frequently, wear proper PPE. And in some countries, there are the vaccination available. Um, so that would be, if possible, to get vaccinated against this disease. However, most of the vaccinations it covers only one of the main species of Leptospira interrogans, but it's already very helpful. It's the most common and highest virulent species. There also exists vaccination against leptospirosis for animals, for your livestock animals. So if your animals have a risk of getting contaminated with this disease, that would be something that would be advised. Control the rodent population as they are one of the main reservoir species that can infect us and our animals, right? So talking about rats, talking about mice, they are one of the most highest reservoir species around the world. So that would be wise. In terms of treatment, if the infection is detected early enough, it may be treated with antibiotics such as doxycycline or amoxicillin. However, I must mention here that treatment or detection and diagnosis is one of the most difficult things when it comes to this disease. The gold standard for diagnosis in leptospirosis is paired microagglutination test, which basically uses live antigen bacteria to react with blood or serum from the patient. However, you need to be able to have that high level of expertise in terms of keeping bacterial cultures or living antigens in order for you to be able to do this. So not any lab can use it can do this, right? The other highly acceptable test would be molecular detection, so PCR through DNA test. Well, of course, I mean, in those low research countries, you don't have this available um, as much available as in other countries. There is some rapid diagnostic tests. However, these are restricted to detect immunity, and then immunity comes 2 weeks after you get infected. So it's a bit tricky. It probably does not um, detect the disease early enough, and it does work for specific or select species of Leptospira, and it all depends which species is going around in the country or in the area. Um, this is just a quick little view of how the the cycle of infection occurs, right? So you have an acute stage where in the first week is where you would have most of these symptoms, right? And it would not appear in your urine, for example, until after in week two, right? So it all depends, and this is the most important one to see. Um, this IgM is the one that we usually test for in these immunological tests. However, this occurs from week two, and then it decreases over time. Only the IgG stays for years in the blood. So that's why you can detect through a microagglutination test if you have IgMs or IgGs, which would tell you, more or less the time frame of infection. But again, blood, for example, you can only culture it in the early stages, but afterwards, um, you can only culture it from the urine. So it really, it's very motile. It will move from the blood from the first week or two into urine. So why is this relevant to One Health? Well, it is a disease that can infect the three domains of One Health, so animals, humans, and the environment through the water and soil, and hence protecting or controlling animals, in this case, protect controlling reservoir species such as rodents, and protecting our animals by vaccination and proper care would protect us as well from this disease. Another thing that is important in terms of One Health is that it affects the tropics and can have a greater toll in low resource country. So it affects disproportionately, right? So this is what I have for you today. Thank you for your attention. And if you have any questions, you can make them in the comment section below. Thank you very much.